Welcome to the Practical Behavioral Care Podcast. Before we get started, a quick disclaimer. This podcast is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult a licensed healthcare provider for personal guidance regarding your mental health. If you've ever tried to make sense of the terms Bipolar I and Bipolar II, you're not alone. Both involve shifts in mood and energy, but the intensity and impact of those high-energy episodes are quite different. Today, we're breaking down those differences in clear, practical terms so you can better understand what each diagnosis means. Bipolar I disorder is defined by at least one full manic episode. Typically, a manic episode lasts 7 or more days, or can be severe enough to require hospitalization. While depressive episodes often occur with bipolar I, they aren't required for a diagnosis. During mania, someone might experience racing thoughts, a greatly reduced need for sleep, an inflated sense of grandiosity, impulsive or risky behavior, and in some cases, hallucinations or delusions. These symptoms are intense enough to significantly disrupt daily life. Bipolar II disorder requires at least one hypomanic episode and at least one major depressive episode. Hypomania is similar to mania but less severe. It doesn't cause psychosis and usually doesn't require hospitalization. People with bipolar II often spend more time struggling with depressive episodes than with elevated moods. Key differences between bipolar I and bipolar II: level of elevation. Bipolar I involves full-blown mania, while bipolar II involves hypomania, a milder form of elevated mood and energy. Functioning. Mania in bipolar I often disrupts daily life and relationships, whereas hypomania in bipolar II can sometimes boost productivity temporarily. Depression. Bipolar II tends to involve more frequent and longer-lasting depressive episodes. Risk. Mania in bipolar I carries a higher likelihood of hospitalization because symptoms can become severe or include psychosis. It's important to remember that neither type is inherently worse. They're different presentations of a mood disorder, and each can have serious consequences if left untreated. Severity and impact depend on the individual, so treatment needs to be personalized. Understanding the differences between bipolar I and bipolar II can help you recognize symptoms and seek the right support. Both types are highly treatable with professional care, medication when appropriate, and lifestyle strategies. If you or someone you care about is showing signs of bipolar disorder, reaching out to a mental health professional is an important next step. Thanks for listening to the Practical Behavioral Care Podcast. Knowing these distinctions is the first step toward getting help, building a plan that works, and taking control of your mental health journey.